first thing I would do when I walk in the room is my infection control. I would wash my hands. I would do my palms, interlace my fingers, the dorsums of my hand. I would then do each finger, the tips of each finger, my thumbs, the tips of my thumbs, and my wrist. Hi, my name is Bermari Figueroa. I'm a student at the University of St. Augustine's Occupational Therapy Program, and I'm going to be working with you today, okay? Can you just confirm your date of birth and your name for me, please?
Bermari Figueroa, September 24, 1970.
Okay, perfect. So what we're going to be doing today is some bed transfers from the wheelchair to the bed. I'm going to be explaining to you each step through the way so you're aware of what we're doing. The benefits of this is to prevent any contractions and get you moving and prevent any skin conditions, okay? You may experience some dizziness or off balance, and if at any point you're experiencing that, just please let me know. If you're uncomfortable throughout the process, also just please let me know. Do you have any questions for me?
No.
Okay, can I proceed?
Yes.
Okay, so the first transfer we're going to be doing today is the standing assisted pivot transfer, okay? So the first thing I'm going to do is make sure my wheelchair is at 90 degrees touching the bed. I am going to place the brakes on the wheelchair to make sure my wheelchair doesn't move. I'm going to place the gait belt on my patient, so please lift your hands and move forward. Perfect. Next, I'm going to remove the legs off of the wheelchair and make sure they're out of the way from the patient, okay? Then I'm going to sanitize my hands once again. The first thing I'm going to do, I'm going to place my foot on the outside of your foot, okay? And place my knee on the inside of your affected leg, which is the right leg. You're going to put your hands on the armrest, and I'm going to hold on to you, and you're going to scoot forward on the wheelchair, okay? So go ahead and slowly scoot till you're at the edge. Perfect. So the next thing I need you to do is make sure this foot is back a little bit. All right. Then on the count of 3, we're going to stand up. So 1, 2, and 3. Perfect. All right. So we are going to slowly pivot towards the bed. So you're going to move your left leg first, right leg, left leg, right leg, left leg, right leg. The back of your knees are touching the bed.
Yes.
Okay, so just reach back with one hand and you can go ahead and have a seat. I am going to lower the bed to make sure her feet are touching the ground completely. I'm going to hand you your call bell. You feeling okay?
Yes.
You have any questions for me?
No.
Okay, perfect. Okay, so the next transfer we're going to be doing is the standing dependent pivot transfer, okay? The first thing I'm going to do is put the wheelchair 90 degrees, make sure it's touching the bed. I'm going to put my brakes on. Then I am going to place my gait belt on my patient. So please lift your arms and just sit up. Lift your arms. Okay, next I'm going to remove my leg rest from the wheelchair, and I'm going to sanitize my hands before touching the patient again. I'm going to place my foot just on the outside of your feet, and you're going to place your hands on the armrest. And and we are going to scoot up on the wheelchair, okay? Go ahead. A little bit more. All right. So I'm gonna place your heels just facing the bed a little bit, okay? And then on the count of 3, we're going to stand up and pivot onto the bed, okay? So 1, 2, and 3. Okay. I'm going to lower the bed so your feet are touching the ground. Hand you your call bell. Do you have any questions for me? You feeling okay?
I'm good.
Okay, perfect. Okay, so the transfer we're gonna do right now is the 1-person fully dependent transfer, okay? So I'm going to make sure my wheelchair is at 90 degrees, touching the bed. I am going to place my brakes on the wheelchair. I'm going to continue to put my gait belt on the patient. So lift your arms for me. Okay, I am going to remove the leg rest and place it away from the patient and sanitize my hands. So I'm gonna have you place your hands on your lap, okay? I am going to assist you in scooting up in your chair, okay? So just lean towards my right and we're gonna scoot up. Ready? 1, 2, 3. Then lean to my left. 1, 2, and 3. Leave your hands on your lap. Once again. 1, 2, and 3. One more time. 1, 2, and 3. Okay, perfect. I'm gonna remove the armrest that's towards the side of the bed. So what I'm gonna do, I am going to hold your gait belt over your arms. You're going to be facing away from the bed. And I am going to count to 3, and we're gonna pivot. We're gonna stand up and pivot towards the bed. Okay. So 1, 2, 3. Okay, perfect. So what I'm gonna do is lower the bed. Make sure her feet are touching the ground. You feeling okay?
I'm okay.
All right, perfect. Any questions?
No.
Okay, the last transfer I'm going to be performing is the sliding board transfer, okay? Once again, I am going to put my chair at 90 degrees, touching the bed. Right now it's a bench because it's a little bit lower. I'm going to put the brakes on my wheelchair on. I'm going to put my gait belt on my patient. So please lift your arms for me. So what we are going to do, I'm going to place my feet on the outside of your legs. Okay, you're going to use your arms to move up on the wheelchair. So place your arms on top of the armrest. I'm going to hold on to you and we're going to scoot up on the wheelchair. Ready? 1, 2, 3. 1, 2, 3. Perfect. So next I'm going to remove this armrest. So I am going to place the sliding board. So you're gonna lean to my left, and we're gonna place a sliding board. Okay, perfect. So what we're gonna do is use lean a little bit to the side forward, and we're gonna slide onto the sliding board all the way onto the bench. Okay. And then as I'm doing this, I'm gonna help your legs. I'm gonna move your legs around as we're moving. Okay. So on the count of 3, you're gonna lean to my left, and we're gonna slide on the sliding board. You're gonna place this hand on the top of the sliding board, but your fingers not under, okay? So you're gonna support yourself. Ready? Ready? 1, 2, and 3, slide. 1, 2, and 3, slide. Alright. Just move your feet. Okay. 1, 2, and 3, and slide. Perfect. Now you're gonna lean to my right, and I'm gonna remove the sliding board. Okay. And I'm gonna make sure the bed is lowered and her feet are touching the ground. Give you your call bell. Do you have any questions for me?
No question.